Hi, my name is Yogeswary and today I will be presenting about the heart. The heart, a vital powerhouse, directs blood through four chambers, which is two atria and two ventricles, it ensuring the oxygenation and nourishment for every cell. Arteries and veins form a crucial network for this life-sustaining journey. Dr. Agarwal, a famous cardiologist, was born on September 5, 1958, was a distinguished figure in Indian medicine. He holds an MD from the Mahatma Gandhi Institute of Medical Science. He served as a senior consultant at Mulchan Med City, New Delhi until 2017. Notable roles included being the National President of the Indian Medical Association and President of the Confederation of Medical Association of Asia and Oceania. He authored health books blending Vedic medicines with modern allopathy. Dr. Agarwal received accolades like the Dr. B.C. Roy Award and the Padma Shri Award in 2010. In May 2021, Dr. Agarwal family revealed his battle with COVID-19 in Delhi. Tragically, he succumbed to the infection and passed away on May 17, 2021 in New Delhi. The heart lies in the mediastinum. The mediastinum is a region between the lungs that stretches from the sternum to the vertebral column, from the first rib to the diaphragm. The heart is bordered laterally by the lungs, posteriorly by the vertebral column, and anteriorly by the sternum. Separating the surfaces of the heart are its borders. The superior border, which runs along a line that connects the second left and third right costal cartilage, is the first of the four borders of the heart. The right and left atriums, as well as the major vessels, make up this section. The inferior border, which runs from the fifth left intercostal space at the mid-clavicular line to the sixth right costal cartilages, consists of the left and right ventricles. The right border is defined by a line that connects the third and sixth right costal cartilage and is bounded by the right atrium, whereas the left border is defined by a line that connects the second left costal cartilage 2 cm from the sternal edge to the fifth left intercostal space in the mid-clavicular line, which includes the left ventricles and some of the left atrium. The tip of the left ventricles form the pointed apex, which rests on the diaphragm. The apex is oriented to the left by anteriorly and inferiorly. The base of the heart is the opposite of the apex, and it is the posterior aspect. The base is formed by the atria of the heart, which is mostly the left atrium. The heart is base located beneath the second rib. It joins to a number of large blood vessels. The costal end of the heart extends downward and to the left, ending in a bluntly pointed apex of the fifth intercostal space. As a result, the apical heartbeat can be felt or heard along the chest wall between the fifth and sixth ribs, roughly 7.5 cm to the left of the midline. Right atrium will collects the deoxygenated blood from the body and then drains the blood into the right ventricles. Right ventricles will pump the blood low in oxygen to the lungs. The lungs then refill the blood with the oxygen. Left atrium receives oxygenated blood from the lungs and pumps it to the left ventricle. Left ventricle pushes oxygenated blood into aorta and pumps blood to the entire body. Pericardium. The pericardium is a fibrous sac enveloping the heart, and major vessels consist of a tough fibrous outer layer and a serous inner layer producing lubricant fluid. The parietal pericardium connects to the fibrous layer while the visceral pericardium attached to the heart wall. This protective structure stabilizes the heart position, lubricates its movement, and guards against the infections. Layers of the heart. The heart wall is made up of 3 layers ranging from the superficial to the deep. Starting from the superficial to the deep layers, epicardium, thin external layer, myocardium is a thick middle layer, and endocardium is a thin internal layer. The endocardium consists of a simple squamous epithelium lining that covers the heart chambers and the valves. It also consists of subendothelial connective tissue. As blood travels through the heart, the smooth endothelium lining of the endocardium reduces surface friction. The helical middle layer, myocardium, is the thickest layer of the heart, and it is made up of cardiac muscle. In the myocardium, the cardiac muscle is a layer of involuntarily striated muscular tissue surrounded by a collagen framework. Muscles fiber are wrapped and bundled with connective tissue sheets, just as those in striated skeletal tissue. It is made up of endomyosium and perimyosium. The cardiac muscle tissue is made up of many branching cells that are connected by intercalated discs to form a continuous mass. Since the disc consists of many gap junctions, a wide portion of the cardiac muscle is electrically coupled into a single functional unit as a syncytium. The left ventricle has a thicker myocardium than the right ventricle, since it pumps blood to the entire body, which demands more pressure. The epicardium, which is the outermost layer, is a thin external layer formed by the visceral layer of the serous pericardium. It is a thin layer of connective tissue that contains adipose tissue that binds to epicardium, to the myocardium, and the cushions the heart. The epicardium contains the nerve and blood vessels that supplies blood to the heart. Vasculate of the heart. The heart's vasculature comprises coronary arteries branching from the aorta, delivering oxygenated blood to the heart muscles. Cardiac veins collect the oxygenated blood, culminating in the coronary sinus that returns it to the right atrium. The intricate network sustains the heart's metabolic demands, ensuring the optimal functioning. The figure above illustrates sections of the cardiac muscles cut in both longitudinal and transverse section. Histologically, the heart is mainly composed of cardiomyocytes and connective tissue. When compared to the skeletal muscle, mature cardiac muscle cells are 15 to 13 m in diameter and 85 to 120 m long. With a striated bending pattern, the diameter of the branch fibers of the cardiac muscle does not differ much. In comparison to the skeletal muscle, each cardiac muscle fiber is shorter. Unlike the skeletal muscle, each cardiac muscle normally only has one centrally located nucleus. The nuclei are surrounded by non-fibrillar perinuclear sarcoplasm zones. If the cut is not across the nucleus, perinuclear sarcoplasm appears as a clear space in the transverse sections. Individual cardiac muscle cell myofibrilles can also be seen in transverse section. The presence of the transverse line that cross the fibers at irregular intervals where the myocardial cells unite is a distinctive feature of the heart muscle. The interfaces between the adjacent cells are represented by those intercalated discs, which are made up of multiple junctional complexes. Many desmosomes and fascia adherens junction make up the transverse region of this irregular step-like disc, which together provide strong intercellular adhesions during the cell's continual contractile activity. The contractile apparatus in cardiac muscle cell is substantially the same as in the skeletal muscle cell in terms of the structure and the functions. Mitochondria occupy up to 40% of the cell's volume. Fatty acids, the heart's main fuel, are stored as triglycerides in small lipid. Cardiac metabolism refers to the biochemical process that occurs in the heart to generate energy for its function. The heart primarily relies on the aerobic metabolism, using oxygen to produce energy through the oxidation of nutrients. Key substrates include fatty acids, glucose, and lactate. During normal condition, the heart prefers fatty acid as its main source of energy. These are oxidized through a series of reactions in the mitochondria, producing the adenosine triphosphate ATP, the energy currency of the cells. Glucose is another crucial substrate for the cardiac metabolism. It can be metabolized aerobically to produce ATP or anaerobically in condition of low oxygen availability. Understanding cardiac metabolism is essential in cardiovascular heart, as changes in energy substrate utilization can impact heart functions and contribute to various cardiac conditions. Normal cardiac metabolism relies on adenosine triphosphate as the primary energy source. About 60 to 70% of ATP fuels the heart muscle contraction, with the remaining 30 to 40% used in ion pumps. The heart's ATP pool is small but crucial for continuous synthesis, as its depletion can impact cardiac functions. The majority, 70 to 19% of cardiac ATP, is derived from fatty acids, while the rest come from the glucose, lactate, ketone bodies, and other amino acids. This dynamic energy balance is vital for sustaining the heart's pumping activity. Heart failure patients exhibit varying degrees of metabolic impairments. Small animal heart failure models display hypertrophy and altered diastolic, systolic functions, reflecting changes in ATP generation pathways, reduced expressions of genes regulating fatty acid metabolism, and increased glucose metabolism genes are observed in rodent models. Generally, failing hearts compensate for reduced fatty acid utilization by increasing glucose oxidation, which is less efficient and generate less ATP. This metabolic shift contributes to the complexities of the heart failure. Phases of the cardiac cycle. Atrial systole begins. Atrial contraction forces blood into the ventricles. Ventricular systole, first phase. Ventricular contraction pushes AV valve closed. Ventricular systole, which is the second phase. Semilunar valves open and blood is ejected. Ventricular diastole, semilunar valves close and the blood flows into the atria. Last is the ventricular diastole. Chambers relax and blood fills ventricle passively. Heart sounds. In an electrocardiogram, the focus is on recording the electrical activity of the heart. It captures the depolarization and repolarization events, showcasing the P wave, QRS complex, and the T wave. The ECG does not directly depict the heart sounds. Phonocardiogram records the sounds produced by the heart, providing a visual representation of these sounds over time. The loop-doop sounds corresponding to the closure of the heart valves are seen on a phonocardiogram. The first heart sounds aligns with the loop and is associated with the atrioventricular valve closure, while the second sound, doop, marks the semilunar valve closure. Cardiac action potential. In cardiac contractile cell, the electrical pattern involves fast depolarization, a plantar phase, and the repolarization. These cells have a stable resting phase around negative 80 MV in the atria and negative 90 MV in the ventricles. The depolarization phase, triggered by sodium influx, lasts 3 to 5 milliseconds. A plantar follow lasting about 0.25 seconds, sustained by Ca2 plus influx, balancing K plus outflux. Repolarization involves K plus outflow, restoring the negative resting potential. The coordinated action potential ensures synchronized contraction and relaxation of the cardiac muscle fibers, crucial for effective pumping during the cardiac cycle. For the last part, we will talk about the heart disease, which is coronary artery disease. The symptoms can be chest paining, shortness of breath, fatigue, nausea and dizziness, and also the heart palpitations. The risks can be hypertension, high cholesterol, stress, diabetes, and also physical inactivity. The diagnosis that can be done is the blood test, coronary angiography, cardiac CT or MRI, or echocardiogram. The treatment can be a healthy lifestyle, medications, cardiac rehabilitations, angioplasty, and also the stenting. In conclusion, the heart is the vital organ that circulates blood through the body via pulmonary and systemic pathways. Coronary artery disease poses a significant global health threat, but medical advancement offer treatment like angioplasty and bypass surgery. Maintaining a healthy lifestyle with no smoking, a nutritious diet, and regular exercise remain crucial for a healthy heart.